Welcome everyone to our January Live Well webinar. My name is Devin Fulford. I am the Director of Education and Content at the Davis-Phinney Foundation, and I'm joined today with Anson Rosenfeldt, who is a physical therapist, and she is a really dear friend of the foundation. Anson, if you want to just tell us maybe a little bit about yourself and maybe just start by telling us what is physical therapy.
Yeah, absolutely. And I want to thank everyone from the Davis-Phinney Foundation and everyone on this webinar today. So thank you all so much for having me. This is a topic that I'm very passionate about. I am a physical therapist, and I have been a physical therapist for almost 15 years now. I currently work at the Cleveland Clinic in Cleveland, Ohio, and I'm a physical therapist as well as a researcher. So I work in a research lab and primarily studying how exercise, different types of aerobic exercise, different types of task training exercise, and different types of technology-enabled exercise affects Parkinson's disease and individuals living with the disease. So today we're really going to talk about what is physical therapy and how physical therapy can play a role in the lives of individuals with Parkinson's disease. So the things I'm going to talk about today are very general. We'll talk at a very general, high level, not specific medical device or advice, and even the examples I give are just general examples. So certainly for more specific, individualized advice, I highly recommend seeing a physical therapist. So to Devin's first question, what is physical therapy? And I think this is a great place to start. So physical therapists are we're movement specialists, right? And we specialize in movement throughout the lifespan. So anywhere from babies, little babies, premature infants, all the way through older adults. So physical therapists work in a variety of settings. We certainly work in hospitals and rehab centers. We work in schools. We work on the sidelines of sporting events. So it's a very diverse profession that treats people of all ages. But ultimately, our ultimate goal is to improve mobility and to improve fitness and to minimize disability and to manage chronic conditions throughout the lifespan. The physical therapy profession is made up of two types of professionals. The first is a physical therapist. And physical therapists, our level of education is we do 4 years of undergrad and then 3 years of graduate school specific to physical therapy. So it's a clinical doctorate program. And then working alongside us in many clinics are physical therapist assistants. And those individuals have a 2-year associate's degree. And so the role of the physical therapist is to evaluate an individual and to make a physical therapy or a movement diagnosis and a plan of care. And then the physical therapist, in conjunction with the physical therapist assistant, execute that plan of care and that treatment plan. So that's really the team.
That makes a lot of sense. When we're talking specifically about folks who have Parkinson's, can you explain a little bit more about what the role of the physical therapist would be and how they fit into that care team for someone with Parkinson's?
Yeah, absolutely. So exercise and physical therapy has come a long way over the past 2 to 3 decades. And I think it's important to recognize where we've come. I mean, even in the 1970s and 80s, we're really telling people with Parkinson's to sit down and take it easy, don't overexert yourself. And then really starting in the late 80s, 90s, and definitely when we hit the 2000s, there's a plethora of evidence that is now out that says exercise is beneficial and is universally good for individuals with PD from both a general health perspective and from a symptom management perspective. So really just a 180 from where we were even a few decades ago. Along with that is just a whole bunch, if you get on the internet and search exercise and Parkinson's, get really almost an overwhelming amount of information and an overwhelming amount of recommendations. And sometimes those recommendations can be rather generic. So for example, do strength training twice a week. But the question is, if I'm an individual living with Parkinson's disease, what does that mean to me? Right? Maybe I was just diagnosed a couple months ago. And what does strength training look like for me? Versus maybe I've had the disease for 10 years and I'm maybe exhibiting a little bit of balance or walking issues. What does a strength training program look like for me? And I think that is really the role of the physical therapist, is to step in and say, hey, there are recommendations out there. There are different types of exercise out there. Let's work together so we can figure out where you need to start today and then what that's going to look like in 6 months or a year, because exercise is not static, right? Parkinson's disease is not static. It's a progressive disease. And over time, we need to accommodate for that and account for that. And that's really where the therapist steps in. Disease progression looks different for everyone. It's on a different timeline. It presents differently. And so no two individuals look the same. And that's where a physical therapist can be extremely helpful, is to step in and individualize those programs for you.
That makes sense. I feel like that's kind of a mantra that we say all the time, that no two people with Parkinson's are on the same journey or the same path with their Parkinson's. So it's really
Absolutely.
important to consider where people are in their Parkinson's journey. Is there a particular spot where you would say you would recommend someone seek that care from a physical therapist?
Yeah, that's a great question. And I think that's something that has also evolved over the years. Is physical therapy used to be reactive, right? So we would wait for an event, typically a non-favorable event, something like a fall, a trip, or a stumble to happen, and then we would consult physical therapy. But really now, we really advocate in the profession for see a physical therapist as early as possible, as early as possible once you get your diagnosis. And so if we can get to people earlier, number one, it allows us to do a baseline. So typically when someone comes into a physical therapy clinic, we do a series of physical exams or standardized tests. So we get things, we track things like turning, gait speed, endurance, and strength. And so we get a baseline assessment. And then our model is kind of just like you see your neurologist every 6 months, kind of this check-in model. You go see a physical therapist as well. And so we have these serial measurements, and then frequently we can catch things early. The earlier we catch things, the more effective our interventions can be at treating those things. So sometimes I get the question of, well, I was diagnosed a few months ago. I'm moving great. I don't have any mobility problems. Should I still see a physical therapist? And I would say absolutely to that. Absolutely. Now's the time. Our goal is to keep you as independent and mobile and not really needing any specialized treatment for as long as possible. Mm-hmm. And oftentimes too, what we do in physical therapy is, we make tasks really hard, and we try to exploit different deficits that maybe aren't completely obvious. So for example, while walking may feel very automatic and easy to someone, say, okay, well, let's walk. And while you're walking, I'm going to have you spell words backwards, right? Or do math problems. And sometimes that secondary distracting task can be very challenging for individuals with Parkinson's. And so that can sometimes exploit where some deficits may lead. So physical therapists are really trained to get in there and look for ways that we can anticipate problems and treat those problems early when we're most likely to be effective.
Absolutely. Yeah, that makes sense.
Yeah. And I would also argue to just remind people that if you start to feel things are more difficult, that may be when it's time to first check in. Like if I had someone tell me just a few weeks ago, like, hey, getting off the toilet used to be kind of automatic for me. Now I find that it takes me a time or two to do that. Well, that is a great time to see your physical therapist and intervene and to hit that straight on, so that we can address it now before it becomes a bigger issue.
Sure. Yeah, definitely. I would assume, and please correct me if I'm wrong, that not every physical therapist is necessarily experienced with or equipped to work with people with Parkinson's.
So in as physical therapists, we graduate as general practitioners. So we have a breadth of knowledge and a little we know something about just general physical therapy. Within that, some people choose to specialize. So we have specialized in everything from sports to pediatrics, orthopedics, and neurology is a specialty that you can get into. If you happen to live in a region where you have Parkinson's specific care, like a movement disorder center or a Parkinson's Center for Excellence, you probably have access to these specialists and this integrated care model. And there is evidence to support that integrated care can help people get the services they need in a timely manner, manage medication, and that can certainly be a perk of these larger medical centers. There's also on the American Physical Therapy Association's website, there is a Find a PT feature. And I believe we're going to post that link in the chat. And so what this feature does is it allows you to go in, you can type in your city or region, and under focus area, you can type in neurology, and a list of physical therapists who have registered themselves as having neurology as a focus area will pop up in your area. So you can check out and find a specialist from there. Now, I fully acknowledge that many people live in regions where access to specialists is not feasible, right? And there is certainly something to be said for being able to go to a physical therapist that's close to your home, right? Things like transportation and convenience, you're just more likely to go if it's convenient to you. So the American Physical Therapy Association, the Academy of Neurologic Physical Therapy, recently put out something that's called a clinical practice guideline for people with Parkinson's. And so if your physical therapist, your local physical therapist, the one that you go to, is not familiar with Parkinson's disease, I would encourage you to provide them with this resource, because what this resource is it really took a whole bunch of physical interventions and really scrutinized the evidence associated with each intervention, and then came up with recommendations. Like, is this intervention highly recommended, moderately recommended? So kind of laid it out there, and it really provides a great guidance to a physical therapist, especially physical therapists who maybe aren't as familiar with Parkinson's disease, as to where should I start? Which interventions are most likely to be effective in this population? And so that is it's a wonderful place to start. It's a wonderful place that really you can help to educate your physical therapist about the most effective interventions for individuals with the disease.
That actually aligns exactly with the next thing I wanted to ask you. So certainly time with any kind of medical professional is limited, and you want to make the most of your time together when you get to visit with a professional. So what might be some things that would be really useful for someone who is just starting their work with a physical therapist, maybe to come up with a list ahead of time of things that, as a physical therapist, you would really like to know from someone who has Parkinson's who wants to engage in the physical therapy journey?
Absolutely. Extremely helpful. I would say always tell your physical therapist your goals. If you want to work on something, if you have a goal, tell us, right? Because we love goals, and we love helping people to achieve their goals. So when someone comes to me and says, hey, I have an 8-year-old grandkid that plays soccer, and I have a really tough time walking over that uneven, hilly surface to get to the sideline of the soccer game. I so appreciate that input, right? Because that is something that I cannot see, but that I can certainly help you to achieve, right? And so this is a very concrete goal. And I think just being straightforward with what's challenging for you, right? So to have, again, someone tell me like, hey, when I get in a certain area of my kitchen, I freeze, right? And it happens frequently. And it's always, this is a situation, this is when I freeze. And it's really challenging if I'm holding something and I need to, try to get to the table. And so telling us those challenges and then your goals can really help you and your physical therapist work together to set realistic goals and to work on things and talk about what's achievable. I also really appreciate when people talk about facilitators and barriers. So what are things that motivate you or are your strengths? And what are other things that are barriers? For example, I really appreciate it when someone comes in and says, look, I work full time. I have a couple teenage kids, and I can exercise 3 times a week for 30 minutes max. That's all I can do. So we need to come up with a plan that fits into your schedule. Or I have someone else who says, look, I get really discouraged when I have goals and I don't achieve them. Right. So that's great feedback for me, because then I know, like, hey, we need to work together to set goals that are achievable but challenging, right? So kind of incremental goals instead of setting these big goals. Whereas other people, may like different things and may respond differently. I've had people come in and say, yeah, I don't like to exercise. I, in fact, hate exercise. I've never exercised before in my life. And I am not going to do this on my own, right? I need some other type of motivation, or I need you to hold me highly accountable, right? So that's when I may say, all right, show me your smartwatch every time you walk in the door, and we're going to look at that activity to start off our session. So if you're really straightforward about your goals, about what your current challenges are, and even what you can certainly express concerns you have about the future, facilitators and barriers, that's going to really lead to a really open relationship where you and your therapist can work together on realistic and meaningful goals.
Mm-hmm. Mm-hmm. All that communication is from the beginning. Is if you've got it there, if you've got it ready to understand, to work together and understand. I love the phrasing of facilitators and barriers. I think that's a really nice way to frame the way kind of any sort of work could possibly be, but certainly physical work in a body that might not be doing the same kind of work it's used to doing for many years. We already kind of talked about how Parkinson's presents so differently for every single person who has it. So we'd like to know more about if there are general types of exercises that you often find that you're recommending for people with Parkinson's, and maybe even if you could kind of give us a breakdown of certain symptoms that a person might be presenting, and then the corresponding exercise that would be helpful for that.
Sure. Yeah. So in general, physical therapists or physical therapy is going to really be focused on your goals, right? And we're really going to tailor it towards your goals. In general, the best kind of exercise programs are usually ones that are multifaceted, right? So they include some type of aerobic exercise, some sort of strength training, some type of balance training. But really, what's key about physical therapy is that frequently things are task specific, meaning that if you want to get better at standing up and sitting down, right, at getting in and out of a chair, we are going to practice that. And we're going to practice that a lot, right? And repetition is our friend. We repeat things a lot, and we make things challenging in different ways to kind of just to continue to challenge both your brain and your body, right? It's really about making that brain body connection. And I'll kind of say, like, when we talk about what kind of exercise is best, that really, it really is individualized. So we really individualized the programs to meet your needs. And I'll give you, maybe it will be most helpful if I give a couple examples of it, right? So I'll start with my individual who came in and said, hey, I have 30 minutes 3 times a week. That's all I can do. So this gentleman was newly diagnosed and felt very comfortable. He's like, I want a program that I can kind of do on my own, and then we'll come and check back in every 6 months. So he gave me very clear constraints in terms of 3 times a week for 30 minutes. That's very helpful. And so what we did is I kind of looked at those clinical practice guidelines, right? Those recommendations for physical therapy and treating Parkinson's disease. And so we started off with, 1 day a week. He had a treadmill at his house. So he was going to do a treadmill walking on the treadmill. And half of the time he was going to work on big arm swings. And the other half of the time, he was going to focus on taking long steps, right? Long steps. So not only are we getting the aerobic exercise component, but we're also getting a little bit of that task specific or that gait training, right? So we're thinking about gait and thinking about quality of gait. And then for the last 10 minutes, his significant other came in and asked him kind of brain teaser questions, right? So he had to keep walking at this vigorous pace while he was being asked these distracting questions. So within that 1 30-minute time frame, I think this really highlights the value of physical therapy. You're able to get in multiple types of workouts, right? So I'm really maximizing his time on that treadmill. Then his second day of exercise was a circuit workout where he did a little bit of aerobic exercise, a little bit of strength training. We wanted to be proactive about posture. So especially with strength training, we worked on some of the muscles in the back of his body, like the back of his shoulders, his back, his glutes, to think about posture issues. And then the third day, he lived in an area where he had access to a Parkinson specific boxing class. And so he went to that boxing class for that time. So that's an example of someone who, felt really independent but didn't have a lot of time, right? And so as a physical therapist, we worked together to kind of say, how can we maximize your time so you can hit the strength training, the balance training in that circuit. You can hit the aerobic exercise. You can do some of that dual tasking all in a relatively short amount of time. We're kind of hitting all that. A very different program than someone who maybe is 70 years old and is retired and has had Parkinson's disease for 15 years and is having difficulties with some walking, right? Some shuffling and some freezing, right? So there, we're going to spend some time. Yeah, we'll still think about aerobic exercise and strengthening, but we're going to do some really specific interventions for walking, doing a lot of time walking, and also some freezing, some techniques to minimize freezing and to break up freezing. So I think, but both of these people I encourage to come back every 6 months. We're going to check in and keep working on these things. And so that as the disease changes over time and progresses over time, we're able to head these things off and manage some of these motor symptoms. So I always do emphasize it's about consistency, right? No matter who you are, where you are in your disease process, you have to be consistent. Just like you take your medicine 1, 3, 5 times a day, exercise is medicine for PD. And you have to be consistent with that effort. That does not mean you have to work out every single day, right? But it does mean that you have to, have a routine and stick to it. And work out several times a week. And again, this is where working with that physical therapist is really helpful to come up with a program that's sustainable and that is dynamic over time.
Mm-hmm. I think all of those things in particular would really help people stay focused on their goals, stay motivated. Looking at exercise as medicine that you have to work into your routine, I think would be also a really useful way to view it. But we're humans, and there are so many of us who really struggle with staying motivated to exercise. And as we know with Parkinson's, we can have these things coupled with depression, which only worsens someone's motivation to certainly exercise. So do you have any particular overarching strategies that you do to help motivate people to really commit and stay focused? Or perhaps if they get off track a bit with their motivation, how to get them back on that motivation road?
Yeah, it can be, as you stated, Devin, those are real challenges. And just exercise in general is a challenge to do on a regular basis for anyone. I am a huge advocate for group exercise programs. I think that those can really hold you accountable, and your workout buddies, your friends in the class, and certainly those friendships develop over time, can really hold you accountable, right? And if you're not there for a few days, people are going to start to wonder. Then hopefully they have your phone number, they can give you a call, make sure you're going to come next time. But so I am a huge advocate for group fitness classes. Now, if you have access to PD specific group fitness classes, that's a huge bonus, right? And there are different cycling classes, boxing classes, delay the disease. There's all sorts of different programs out there. There's some areas have Parkinson specific gyms, and those are true. Those are great places to be. Not every place has those, right? But most places do have, if there's even a community gym, it doesn't have to be necessarily a PD specific class, right? There's programs like Silver Sneakers. There's different sorts of yoga group classes, different cycling classes that may not be PD specific, but you may be able to adapt to your needs. And if you have a gym that's an instructor that is willing to work with you and learn, that can be a great place to be. Or I would say too, ask your physical therapist, because sometimes physical therapists have other people who are looking for buddies and know different support groups around that you may not be aware of, and they can hook you up with different support systems. But if you don't have any of that, even having a friend who is your workout buddy can really be helpful to facilitate that motivation. I've also had success just with like or not even smartwatches. This is not a smartwatch. It's just an activity monitor device. And that can hold you accountable. And I do check those on a regular basis. I will say, show me your watch, show me what you've been doing. And so that type of technology can really hold people accountable. I'll also put in a plug for the Davis Phinney Foundation and organizations similar, is that just being part of those organizations make you feel connected, and that social connection is really critical in staying motivated in managing your disease.
So before we switch over to a few of the questions that we have received from our audience, Anson, can you kind of tell us a little bit about, as someone progresses through their Parkinson's journey, are physical therapists still considered a crucial part of that care team? And maybe how does that change as someone progresses?
Yeah, absolutely. So I am a huge advocate, and evidence supports physical therapists can be effective at any stage in your disease. So I would say any time is a good time to work with the physical therapist. As the disease progresses, one of the main roles of the basal ganglia is to initiate and sustain movement. So as the disease progresses, individuals have difficulty initiating and sustaining movement. And so there's different techniques that we can use to kind of get other regions of the brain to help create that movement, right? So, for example, you can use things like visual cues, so like lines on a floor or different visual cues, and that can help to create movement or initiate movement, take bigger steps, break up freezes and things like that. So that can be helpful. Visual cues can be one. Auditory cues can also be helpful to, again, breaking up freezing. Things like metronomes that give you a very stable beat. We use those a lot in therapy. And really what all this cueing does, it helps to bring other regions of your brain, again, to create that movement that maybe the basal ganglia is not doing as it should. Now, that being said, oftentimes those cues need to change over time, right? They can become less effective over time, or you can habituate to them. So again, that's why you need to keep coming back, right? Because we got to keep reevaluating your movement and keep seeing what other techniques we can bring in to help with things like turning and freezing and things like that. The other thing that physical therapists can be really helpful with is assistive devices. There's a lot of different types of assistive devices out there. That, for example, I'll just use the example of walkers, right? There's walkers with wheels, there's walkers without wheels, there's walkers with seats, there's walkers with handbrakes, there's all sorts of different types. And so therapists can be very helpful in determining when you need an assistive device, or just what's kind of best in that case. And I'll give an example of a gentleman that I had who was he had a lot of freezing of gait and just difficulty with gait, and he was going to Washington D.C. with his family, and he wanted to go visit a whole bunch of museums, right? Is a great thing to do in DC. And so he was very nervous about just being in those closed spaces. And so, and how that would affect his gait. And so we worked together and said, hey, let's try. He'd used walking sticks before, and that was effective for him. But I said, let's use the walking sticks and try it, because not only can it help with your walking and your gait, but he had a specific thing he could do with a walking stick, a cue that he would use to help break up his freezing. He would bang his stick, and that noise would help him initiate his gait and get out of that freeze. As well as, too, the walking sticks, he was very nervous about the crowds. And sometimes, just having those sticks, it would make people kind of move, give you a little bit of space, right? And so when he came back, he was very happy with how it worked out. He said, people were patient with me. They gave me space, and I was able to, have a very enjoyable trip. So that's just one example of how that can work out. So that's an example. And then the other thing I would say is it can be very helpful with caregiver training, right? So, for example, as someone come in and say, like, I'm having a lot of trouble in bed, turning over in bed, right? Turning in bed can be very challenging, getting in and out of bed. And, she said, my husband wants to help, but we just end up kind of wrestling with each other and getting tangled up with each other. And so that's an example too, where a physical therapist cannot just help the individual with the disease. We can really help the whole care team and help the care partner figure out the best ways to help someone and to navigate life. Same thing with freezing. I had someone come in who just started to have some freezing. And so he was walking hand in hand with or they would kind of link elbows, and she was kind of pulling him through freezing. And it's actually generally not helpful to pull someone through a freeze, right? It just really gets everyone tangled up and off balance. And so we talked about freezing and what it means, and how actually she can still help. And we developed a way that she could help break up freezes that lasted for a while. But that the most important thing with a freeze is let's pause for a minute. Let's take a breath and let's develop some techniques to help break up that freezing. But pulling someone is not a favorable way to do that.
Not recommended from the physical therapist.
It's not recommended. And then the other thing I'll say about physical therapy and really just life in general is that, Parkinson's disease is not the only thing that in general people are dealing with, right? There are other health conditions and other life situations, medical events that arise. And I got a call a couple of months ago from someone who said, I'm having a knee replacement next month. And he really enjoyed cycling, right? He was very, very enjoyed a stationary cycle. And he said, I'm really nervous and scared about how my knee replacement is going to affect my exercise routine. I know I'm not going to be able to cycle. And the truth is no, you're not. You're not going to be able to cycle for a few months. And so at least in the way that you would want. And so let's talk about that. And let's talk about, what's going to happen and how we can work together to still manage your Parkinson's disease, exercise for your PD, but then certainly, we have to rehab that knee as well, right? So Parkinson's disease is not the only thing that you're dealing with. And we need to think about that from a holistic health perspective. And then finally, I'll say that PTs can come into your home. And so if it gets to the point where going out and receiving outpatient care is no longer the most comfortable or the best or the safest option, then have a PT come into your house, right? It's a very intimate experience, and it can really let the physical therapist see exactly what you're dealing with and exactly what equipment you have, what your home setup looks like, and how we can best manage that home situation.
Oh, that's great. Someone specifically asked about if there is home accessibility for folks on Medicaid, if that's an option. So that's good to
Yes.
know.
Yes. So home therapy is an option, and it can be a great option for people.
Absolutely. Well, we have roughly 20 minutes and we have quite a few questions from our community. I'm trying to kind of combine some of them so we can answer as many as we possibly can. So we discussed motivation, right? I think that's super important in general when we're talking about exercise. So it can be really easy for someone sitting in front of a physical therapist, getting the information, oh, this feels good. I'm going to do this. No problem. Yes, thank you. Let's go do it. And then they get home and they don't feel so motivated anymore. How do you help, or do you play a role in helping people actually do the exercise when they're in their home? And then also, if you have to give someone kind of bad news for some reason, like the exercise isn't helping, or maybe they haven't done it enough and you need to encourage them to do it further, what are strategies that they can kind of take in that information without it just overwhelming and derailing the whole program?
Yeah, so couple parts to that question.
Yeah.
So right, physical therapists are not at home with you. I'm not at home with you. And so our role is, right, I'd say we check in on a regular basis, and that's good, right? But our role is to help you become independent with your own exercise program, whatever that looks like for you. So to figure out the most effective exercise program for you at this time, and to help you execute that independently or in the community or whatever that best looks like for you. Certainly when you're under our care, we hold you accountable. Like you always have some sort of home exercise program or homework to do. And usually there's some way that we have you record what you do. And so that can really help with accountability, is really keep almost like a homework diary or an exercise diary, and show that to the physical therapist when you come home, or when you come into the clinic. But really it is about kind of working together to change behavior and to eliminate barriers that may stand in your way of doing these exercise programs. And there's certainly not a one size fits all approach to that. But some of those, like I said, the group exercise or finding a buddy or finding a support group can all help with that. But there's no exercise is hard, right? But it's also empowering. And
Yeah.
so I think if we really try to stress that, like, exercise is something that is for the most part in your control. And if we find an exercise program that is feasible and reasonable for you to do, then it's accomplishable, right? And hopefully people get a sense of accomplishment from achieving that and feel empowered by that. But certainly, and then also depression and anxiety can play a role. And so I will encourage people or refer people to manage those symptoms as well, because depression, it needs to be managed, and whether it's by medication or by behavioral therapy, just taking that holistic approach and managing that. And then Devin, as you mentioned, exercise can certainly help to control symptoms of the disease, and there is some evidence coming out now that exercise can delay or just slow down the disease, but exercise does not stop the disease, right? The disease will continue to progress, even with the best, of exercise plans. And so it's important to be realistic about that, and to set goals that are realistic. And that is definitely an important part of the conversation that we'll have, right up front, is what's realistic based on where you are right now. Because, me as a physical therapist and you as someone living with the disease, we need to come to an agreement on what's realistic and what goals that we're both working towards. So those can be, tough conversations, but ultimately that shared decision making, that shared respect is a critical part of that partnership.
Mm-hmm. Oh yeah, absolutely. We have a question. We haven't, I mean, this isn't your realm of expertise, but can you tell us a little bit about the difference in physical therapy and occupational therapy?
Oh yes, that's a wonderful, wonderful question, right? So there's really three types of therapy. There's physical, occupational, and speech. We work very closely together, right? We are buddies with one another. We frequently refer to one another. So physical therapy, and I'm gonna make gross generalizations here. Again, this can kind of vary from clinic to clinic, but physical therapy, we typically work on kind of big motor skills. If you think about things like getting in and out of a chair, walking, going up and down stairs, those are things that physical therapists work on. Versus, let's see, occupational therapy, they're really focused on helping people kind of function in their day-to-day lives, instrumental activities of daily living. So things like balancing a checkbook, some different hygiene things. Those are things that occupational therapists work on. But also, occupational therapists will work on some cognition as well. And then speech therapists will certainly work on the speech, swallowing, and cognition as well. So there's certainly overlap between, and I wouldn't think of them as completely discrete tasks, but if you're having a lot of trouble with tying or buttons, that's probably going to be a little more fine motor, a little more activity of daily living, instrumental activity of daily living. That's going to be a little more OT. Physical therapy, you're going to work on your big gross motor skills, and then speech therapy, you'll work on the speech and swallowing, excessive saliva and drooling, things like that.
Got it. That makes a lot of sense. So a lot of times people might ultimately need to see or want to see all three of the therapists in the different specialties.
Yeah, absolutely. Absolutely.
So I love this topic. We've got a lot of questions about alternative therapies. And I don't
Yeah.
know how much you might want to speak to these, but people are asking about the benefits of massage and acupuncture specifically.
Yeah, no, those are great questions as well. There's not as much evidence behind things like massage and acupuncture, really either for or against. So I don't have like a strong medical recommendation, but I would say if you feel like it benefits you, then there's usually not. If you like to try it, that the risk is typically low for something like a massage. I mean, there's really not risk. Now, is there evidence that it's going to control your symptoms? Or there's not as much evidence to do that. But I always tell people, if symptomatically it makes you feel better, or anecdotally it makes you feel better, then it certainly doesn't interfere with with the physical therapy treatment at all. And some individuals have success with it, and some don't. So yeah.
Very subjective to the person who
Yeah.
decides to do it. Sure. We have a question here about whether you tend to focus doing physical therapy when people are having their on periods or off periods or both, and how do you manage that?
Well, that's a wonderful question. Um, you know, we typically do therapy. If someone comes in whatever medication state they're in, we will certainly treat them, but it typically we do it in the on state. I typically tell people, if you can schedule so that your meds are going to be, working or most effective, then that can be beneficial. There's some thought that it can help with the motor learning if you're on your on state, but that is not definitive. So typically people will be in your on state, when they exercise at home. I will typically encourage people to exercise when their medication's working, because, if you're doing something like aerobic exercise or even strength training, that the intensity component is important, right? We want you to be able to put in the repetitions and put in the effort, right? If you're walking or cycling, that speed can be an important component of it. So being in the on state can be beneficial for that. Yeah.
That makes sense. Let's see here. I've seen a few people asking if you could give specific recommendations for folks who have dyskinesias.
So yeah, I mean, dyskinesias can result from long-term levodopa use and results in those extra movements that you see, right? And so there really aren't any specific exercises that I'm aware of that specifically treat dyskinesias. Sometimes rhythmic movements can help. Something like a cycling or a walking can help with the lower extremity dyskinesias. But it's really just a matter of that medication kind of wearing on and off. That is the primary factor in those dyskinesias.
Sure. Let's see. I feel like you've kind of already given us some really specific kind of like case study examples from your own experience, but are you able to share any specific success stories and maybe kind of explain what your patient was presenting with when you first saw them and how you might have helped them through that, and if you're still working with them now?
Yeah, sure. So definitely. Let's see. I think I'll probably start with, I recently had someone come in who's having a lot of trouble with standing up from a chair, right? And so it's just difficulty getting up and getting out of the car, right? That's another good example of kind of those bucket seats. Just getting in and out of the car can sometimes feel like you're wrestling with the car to get in and out. And so that's a really good example of a very specific task, and where I really appreciated that individual. You're just being like, hey, look, it's chairs. I'm just having trouble getting out of chairs. And if the chair doesn't have an armrest, like I really get stuck. And so we worked on on chair transfers, it just so much. And so often I'm going to make a generalization about Parkinson's right now that isn't true for everyone, but holds true a lot, is in general, with Parkinson's disease, movements become smaller and slower, right? So so often what we do in physical therapy is we exaggerate big and fast movements, okay? So it's all about exaggerating, making your movements big and faster. And it can sometimes feel a little silly to the person who's doing it, but it really doesn't look silly to, it doesn't look that silly. It's just a little bit bigger movement than you would do. And so what we did is we did a lot of coming in and out of the chair and pushing up and doing big arm circles up and big arm circles down. So exaggerating these movements. And we did it from all different types of surfaces, low, high, medium. We would sometimes do it with a twisting motion to break up some of that rigidity or that stiffness. And then we just really focused, in addition, we did a lot of getting on and off the floor just as a strengthening task, and some walking and gait as well. Again, just really focusing on exaggerating all of those movements that come with walking and transferring. And so the end result was very positive. We also went out to his car one day and just practiced getting in and out of the car over and over again. So, they're just examples of doing the task over and over again, exaggerating the deficit, and leading to a successful outcome.
Are you still meeting with that particular person?
No. Well, periodically, again, we kind of do that check-in model. So we periodically check in and just kind of update his exercise program. And then during that periodic check-in, that's when we decide, like, hey, do we need to do a focused bout of, 2 times a week for 4 weeks? If, like, for example, we did a focused bout to work on his transfer problem. And so we did a focused bout. And then he went off on his own and is doing things on his own. So then I'll see him in a few months. We'll again do the same standardized test, see how he's doing. And if there's any specific deficit, if he's having any issues, then we will again address it with a specific bout for however long he needs, right? So that's kind of how we plan it is come and see me. We can address these really specific goals, and then you go out and do your program on your own. And then we'll check in 6 months and we'll see how things are going. If everything's going great, perfect, keep it up. But if things have changed, then we can adjust your program.
Mm-hmm. And with the understanding and assumption that everyone is so different,
yeah.
Do you have kind of a generalized recommendation for how often someone sees a physical therapist?
So right now, what I kind of say, and what a lot of people in the field say, is just every 6 months. Every 6 months, come and do a check-in and talk. I'd say if you find a physical therapist, talk to them and kind of see what they're doing. You may need a referral from your physician. I've never had a really problem getting a referral from a physician, even because usually physicians are very for exercise, and especially your neurologists, your movement disorder specialists, they know that exercise is good. So it's rare that anyone would say no to that. So some physical therapy offices will allow you to come directly to them. Some need a referral. You kind of just have to talk to them to figure out what their access policy is.
And what your insurance might cover.
Yes, and what your insurance. So they will check for you for all of that.
Yeah, absolutely. We don't have too much time left, Anson. What are we missing? What are some final words of wisdom that you'd love to share with our community today?
Yeah, we've covered a lot today. And I hope that, the end message is don't be afraid to go to a physical therapist. I think I always say there's very little downside. You're going to exercise and that's generally beneficial. You're going to get some exercise advice and you're going to get a very targeted evaluation from someone who is a specialist in the movement field. And so it's really an opportunity to add to your care team and just to make sure that, you have another piece to that holistic puzzle of managing the disease.